Acute injuries caused by sport or by accidents, rheumatic complaints or degenerative disorders, such as arthritis, generally cause pain and functional impairment and make everyday life a torture for the person afflicted. Painful disorders of the locomotory and musculoskeletal systems are widespread and pose a special challenge to physicians. It is estimated that about 10 million people in Germany suffer from inflammatory or degenerative afflictions of the joints and spinal column. 80% of these complaints are estimated to be degenerative joint disease. Despite the wide range of therapies available, from physical applications to surgery, many patients can be given little or no help. It's precisely this group of patients, therefore, who require alternative therapeutic treatment.
These complaints started 10 years ago, and I needed constant medical treatment. And then the doctor said I needed a new hip joint because I had arthritis in both joints. I thought, well, I'll just have to bear it. And then they suggested cortisone injections, but I refused to have cortisone. Due to the injury on the left knee, the right knee began to hurt, so I consulted doctors. At first they treated it with ointment, and then I did gymnastics. I thought it would get better, but it didn't.
I went to the doctors early this year with a really bad back. It was so bad I could hardly walk. He examined me and said I'd got a double-sided slipped disc at the base of the spine. I had treatment, but it didn't help at all. Eventually, the doctor in charge said I would have to be operated. I didn't want an operation, so I said, let's try something else. Anything but an operation. An entirely new therapeutic method is the pulsed signal therapy, PST, a biophysical method of treatment. PST differs quite fundamentally from conventional treatments, in particular from physical methods such as magnetic field therapy, electrostimulation therapy, or warm-cold therapy. PST has been successful in treating over 10,000 patients worldwide who are suffering from painful arthritic afflictions of the locomotory system. I'm convinced that this therapy has to be taken very seriously. Otherwise, we've hardly any other alternatives. Chondroprotective treatment is no longer applied. Hyaluronic acid is still given, but most of our other therapies only treat symptoms. In my view, pulsed signal therapy can be applied in the treatment of every case of arthritis, including coxarthritis, gonarthritis, post-rheumatic or idiopathic arthritis of the ankle joint or the upper extremity. It can also treat arthritis of the cervical and lumbar vertebrae with or without disc complaints, as well as fibrous tissue ailments, for example, disorders of the tendons, membranes and bursae.
The group of patients that we studied most carefully were those with osteoarthritis. We studied those patients in several randomized, double-blind, placebo-controlled studies. We recruited patients who satisfied criteria for osteoarthritis of the knee and those who had osteoarthritis of the neck. Radiographically, they had to have symptoms for a minimum of 6 months. They had to be at least 38 years old. They could not have a secondary inflammatory rheumatic disease. And so basically, we didn't want a heterogeneous group. We wanted patients whose pain was solely due to osteoarthritis, if that's possible. If they were already taking an anti-inflammatory medication or physical therapy or what have you, we asked them to continue the same treatment, and the only variable we wished was the addition of the pulse signal therapy. We evaluated them at baseline, midway through the treatment, at the end of treatment, and 1 month post-treatment, and we found that usually beyond midway, at the end of treatment and 1 month post, there were meaningful differences. There were approximately 75% of patients who improved in our pilot study, and then in the larger double-blind placebo study, approximately 70% improved.
It was the biophysicist and physician Dr. Richard Markol who some 20 years ago began to investigate the effect of a signal to stimulate cartilage repair, delivered by a pulsed electromagnetic field on the growth and regeneration of cartilage and dense connective. Dr. Markol spent years developing the PST signal and devices for treating inflammatory and degenerative bone and joint ailments.
Pulse signal therapy is a new way of treating joints that have suffered acute injury, such as sports-type injury, or that have undergone degenerative joint disease, such as osteoarthritis, over years. Pulse signal therapy allows us to treat these joints quickly and effectively. The basis of pulse signal therapy is simply to mimic the body's own signal, the original physiological signal that stimulated the healing process and the repair process.
What the pulse signal therapy does is to restore the electric field of the joint being treated. We've known for some time now that in bone tissue, growth is regulated by electrophysiological processes, by so-called piezoelectric impulses. Magnetic field devices have long been used to stimulate the growth of bone in non-healing bone fractures, using another magnetic field through which pulse signals are transmitted to the afflicted joint. Dr. Markol has now succeeded in stimulating the growth of cartilage tissue and the growth of chondrocytes. Every movement of the joint produces a massaging effect on the cartilage tissue. This massaging effect is vital for the nourishment of the cartilage tissue, but it also induces a flow of fluid, which gives rise to a so-called streaming potential in the joint. This potential is largely formed by a shifting of hydrogen protons. Virtually every disorder of the musculoskeletal system disturbs motion in the respective joint, leading to a reduced formation of the streaming potential. We refer to a disturbance of the electric field in the joint concerned. PST, with its specific pulsed signals, apparently succeeds in forcing the hydrogen protons to migrate in the electromagnetic field, thus creating the required streaming potential. Dr. Markol has developed a range of PST equipment to enable every region of the body, or every joint, to be treated with pulsed signals. According to the patient's specific complaint, the joint is placed in an air coil and, in the course of 9 daily sessions lasting 1 hour, is subjected to pulsed signals in the electromagnetic field. In this way, signals are transmitted to the body which induce self-regeneration in the respective joint.
Ich habe mir gedacht, ich probiere es, nachdem bis
I
dahin
thought I'd try it. Since nothing had helped me so far, I felt it was worth trying. I went to the medical center and took 9 successive hours of daily treatment. I only felt pain in the knee during the first session. After that, there was no pain whatsoever, and after the 9th session, I got up free from pain.
Schmerzfrei aufgestanden.
During the first 3 or 4 hours, I didn't notice any progress. You don't feel anything. But after the 4th, 5th time, I could feel something was happening.
The pain increased a little bit during the first few days, but it didn't last the whole time. The turning point came on the 5th day, when the warm feeling increased considerably. A stream flowed through the whole leg up to the hip, and I thought my leg was swelling up. But that stopped suddenly, and the pain was really gone.
Der Patient muss wissen, dass die Behandlung zunächst
The patient must realize that at first the therapy can increase local pain. That's often an indication that the treatment is taking effect, and it's therefore a positive sign. But patients should know that, so that they don't decide to discontinue the therapy. Optimal therapeutic success, a definite alleviation of pain and improved bodily movement, normally sets in after 4 to 6 weeks. That's easy to explain because we stimulate regeneration on a cellular basis, and the body needs this space of time to carry out the corresponding regeneration.
The overall improvement came within 3 months. I already felt better after the second or third session of treatment. And after 9 sessions, I felt absolutely no more pain. Not even after spending 12 hours in a plane 2 days after finishing the therapy. After about 2 or 3 weeks, I already felt much, much better. And now 6 months have passed, and I've no pain at all.
Mir wurde allerdings gesagt, dass
They told me that some pain might return within 2 to 3 weeks, and it did. But after a further 4 to 5 weeks, I was absolutely free from pain. That was 4 months ago, and I'm still free from pain today.
4 Monate zurück und ich bin bis heute schmerzfrei.
Since early 1996, the PST method has been used successfully in treating patients outside the United States and Canada. And in the meantime, many PST treatment centers have been set up in several major European cities. PST has now established itself in hospitals and medical practices throughout Europe.
Ich habe diese Methode kennengelernt im Rahmen ihrer wissenschaftlichen
I read about PST in the Journal of Rheumatology.
Ich habe gesehen, dass diese
I saw what this method could do while I was visiting Dr. Markle in Florida. I was, and I still am, firmly convinced that the PST method benefits my own patients and medicine as a whole.
Wir haben bis dato
So far, we've used PST to treat 150 patients.
den Fragebogen 4 Wochen
140 of them returned our questionnaire 4 weeks after treatment ended. On these returns, 74% of the patients treated report that they felt better to far better. 26% said the treatment was not a success. But none of the patients said they felt worse. I believe that PST is a true benefit for our patients. It gives me great satisfaction to share the happiness of a patient relieved of pain after years of suffering. And that doesn't happen every day to an internist.
aller Tage begegnen.
It was a great experience for me, absolutely new, because most sport injuries go on for weeks. I was really surprised. Such a great improvement. I was very surprised. I think I'll get my left knee treated too. I'd say I'm feeling better all round. I've got a really new quality of life.
In Europe, the discussion on PST has already gotten underway. At the first International PST Symposium in Munich, noted scientists and physicians from all over the world discussed the potentialities and limitations of this therapy. We must take this therapy seriously. That was the purpose of this symposium. We have the results from America and are in the process of utilizing them here. Of course, we still have to experiment very systematically with PST.
Ich bin der Meinung, dass die Zurückhaltung...
In my view, there's no further cause to be skeptical about PST. This therapy should not only benefit patients who've already tried many other therapies. I mean, patients who've been treated medicinally and physically without success. It must also be applied to patients suffering in the early stage of the affliction. PST is a new therapeutic method which naturally still leaves a lot of questions unsettled. This poses a challenge to physicians and scientists alike, for the therapeutic success of PST already speaks for itself.
Die pulsierende Signaltherapie handelt
PST Germany, which has its headquarters in Munich, is striving to make PST therapy available to patients in Germany as quickly as possible. The company will cooperate throughout Germany with physicians, hospitals, rehabilitation clinics, and the first batch of 10 centers has already been opened. Cooperation mainly involves orthopedists, internists, and general practitioners, as well as other physicians who treat patients suffering from arthritic complaints. Cooperation takes place within the framework of a cooperation contract, under which we lease physicians the requisite therapeutic equipment. We also integrate them into our information system, which enables us to advise patients where they can obtain treatment.
Nach Behandlungsstandorten erkundigen, auf ihn verwiesen werden.
Pulsed signal therapy. For many patients, this already means the rapid and unproblematic relief from chronic pain, improved bodily movement, and the resumption of a normal, everyday life. Please contact us for more information on PST.